Hello, I'm Marie Walton-Mahon, the founder of Progressing Ballet Technique, and it gives me great pleasure to introduce Debra Crookshanks. Debra is the founder of the Dancers Clinic in Sydney, Australia. What are some of the clinical features of students that are hypermobile? And what advice can you give to teachers to assist these students that are often unstable in one or more joints and their balance can be problematic?
That's a really good question, Marie. So clinical features may include pain around the joint, either at the time of performing these extremes of range of motion or after the class, when the extremes have been used within the class. We start to see some disturbed proprioception. So balance and coordination is quite difficult. As a result, the students perhaps aren't able to work well within their range. They can have some muscle weakness around the joint. We'll then start to see this poor coordination. So we see this axis of evil, if you like, of proprioception, poor proprioceptive acuity, muscle weakness, and then difficulty with balance and coordination. So there's some of the features that I think will be quite easy for dance teachers to pick up. Common areas of hypermobility that we see in dancers, of course, are the hyperextended knee, the banana knee, so the hyperextension at the knee. We also see very flat feet, or pes planus. Very flat feet, no arch. It tends to be a very mobile foot, a very weak foot. These students will have difficulty even attaining a dome or a sling. And of course, when it comes time to go on point, this will be incredibly challenging. And if these students can't control this strength, then they'll have to be delayed for a year or more with their point work. We're very familiar with the extremes of range of external rotation in the hip, these students that can just mount their leg that goes behind their head. These students can also sit very comfortably in a front split and lean forward and do roll-throughs, and these tend to be hypermobile students. Low back extensions, we see those very deep into range backward port de bras, where the dancer's body and their back can be at 90 degrees to each other, and it's worrying for the lumbar spine. And then scoliosis. In very hypermobile students, we can actually see a form of non-congenital scoliosis. So these are all things, again, that the dance teacher is well placed to see in the class. So my advice for dance teachers who find themselves with a hypermobile student, just be aware of the student. Just be aware that they're in your class. Monitor them for any unnecessary extreme stretching, or will probably want to sit in front splits or over split like their colleagues in class. Monitor them for that. They really can't be doing that. Monitor also for recurrent pain around that hypermobile joint. That's often a sign that they may not be at the left-hand side of the spectrum, but starting to move towards the middle. Yeah. Reinforce trunk strength and stability. And if you possibly can, establish a really good, strong rapport with a practitioner who may well be managing these dancers very well. I think dance teachers can find practitioners that they respect, that they know have done a great job with some of their students. Get in touch with them, speak to them. Certainly as a physio, I love it when dance teachers call me. I love it when they come to sit into the assessments.
Absolutely.
So I think that's a really nice, important thing to do too.
And, at every course that I deliver, I encourage the teachers to find a dance physio and a rapport, like we used to do with reports coming back to me.
Yeah.
So you know exactly what you're dealing with. And that clarity is so valuable.
That's it. It's a diagnosis, but it's also the management, isn't it? It's how to manage it.
And it's a team.
Yes, absolutely.